If you wear contact lenses and you're struggling with that solution that irritates your eyes, well, hopefully we're going to answer some questions for you. We're going to talk contact lens solution safety with optometrist Dr. Jeffrey Schultz. Welcome back to the show, sir.
My pleasure. Good to be back.
All right. I don't wear contact lenses. I have a lot of friends that have it.
Correct.
It always, I'm always intrigued when I see the solution and what it does to your eyes. Now, how much have they changed over the years?
Solutions have changed significantly. Soft contact lenses were first approved back in roughly 1974, and at that point the patients made their own saltwater solution, their own saline solution with salt tablets and distilled water and heat disinfection. We've evolved now to what are called multi-purpose solutions.
What exactly are the multi-purpose?
Multi-purpose solution, the idea is to disinfect the contact lens. We want to kill the bacteria, the fungus, and destroy what has come in contact with the contact lens so it doesn't infect the eye.
Are there different type of disinfectant solutions?
Yes, depending on how the solution is used, it could either be a solution that you have to rub before you store the lens, or you can just put it in your case and go your merry way.
Do they, all the stuff that you're talking about in these solutions, does it contain preservatives? Because I would assume that the preservatives are what's irritating the eye.
Correct. One of the major factors in the irritation is the preservative. The original preservative was called thimerosal, which is a mercury-based solution similar to the merthiolate or mercurochrome that many people used when they were youngsters. The thimerosal was very irritating, caused many patients problems, and is no longer being used.
Obviously you've replaced it. What exactly did you use to replace it?
Over the years, the manufacturers have come up with newer products, newer disinfecting solutions, and newer preservatives. The two most common that are being used today, one is called biguanide and the other is called polyquat. And the different manufacturers use different formulations of these two preservatives.
All right. Now, what other than just irritation, can it actually harm your vision?
Well, what happens when the lens is soaked in the solution, the lens acts like a sponge and absorbs the various products, the solutions themselves, the chemicals, and the preservatives. The lens goes onto the eye, it lets those chemicals back out, lets the preservatives back out.
So we're kind of back to the preservatives.
We're back to the preservatives again. And now these preservatives cause different amounts of irritation. And the problem is that the FDA approval procedures for contact lenses and solutions don't require that one test with the other. They're approved as a lens or they're approved as a solution, but the specific solutions may not react correctly with a given lens.
All right, so going over all the things that we've just talked about, are these problems resolved?
No, they are not resolved. I wish they were, but they're not. Earlier this year, there was a product called Bausch & Lomb Renew with Moisture Lock, and this was a product with its own specific preservative that when it was put onto the eye caused some significant irritation, and there are now 166 confirmed cases of a fungal eye infection, which is directly related to this solution and working with the contact lenses.
All right, well, obviously we're talking about safety. We have some pointers for the audience to go over, and please pay attention to this because obviously your eyes are, the most important things for you. And we'll just read through them, then you and I can talk about it. Correct wearing time, fresh solution every night, solution and lens compatibility, and do not use the B&L Renew with Moisture Lock.
Correct. Correct wearing time means the number of hours in a given day that you wear a lens, and the number of days that you wear a disposable lens. Lenses are approved by the FDA as a 1 to 2 week lens. Don't wear that lens for 3, 4, 5 weeks, 6 months. If the lens is approved for a month, don't wear it for 2 or 3 months.
All right, well, doctor, I know a lot of people are going to have questions for you, so if you want to contact this man, Dr. Jeffrey Schultz, you can contact Lifetime Eye Care at 216-581-8484 or go to the website myeyedoc.com. Thank you very much.
My pleasure, Michael.
Thank
you.
All right, coming up on Good Company. You're out all day and you want someone to